Plastic Surgery Talk. Brought to you by Mentor, maker of memory gel breast implants.
Welcome back. We're here with Pat Sullivan talking about eyelids, and we're going to take a question from one of our email viewers. This is from Laura A. from Largo, Florida, and she writes, I'm tired of looking angry when I'm not. I need a brow lift badly, and I'm wondering about the cost and recovery time and whether endoscopy is involved, and does this shorten the recovery time?
Those are some great points that you made there, because there are many times when the eyelid surgery alone will not do it. When you need to have the brows addressed, you need to have that tissue brought up into a more normal position. It's sagging down in the temple area and especially the outer brow region. You don't necessarily want to have the inner brow brought up, but it's that outer brow that can cause the sagginess of the upper lid to go way out here. So you'd end up with a huge incision if you just tried to do it with eyelid surgery, and that's a big mistake. So what we do is we bring the brows up to a normal position, the temporal area up to a normal position. It even helps with the crow's feet, and that it can be extremely powerful. So I think she's right. She's onto something, because a lot of patients don't understand how important the brow lift part is.
Yeah, the brow lift thing, let's stay on that theme just for a minute, because Good. I think a lot of patients have heard, well, they're going to look really surprised. If they raise their brows up, they're going to always look like they're surprised. But that's not necessarily the case, right?
No, absolutely, it's not the case. And that question took us to the laboratory at Brown, where we did a lot of anatomic studies to find out just what the anatomy is in this area, so we can selectively reshape certain parts of the brow to try to make them as symmetric as possible and to try to have them look as much as possible like the person used to look. Have them bring pictures in of when they were 18, 20, 22 years old, see what the brow naturally looks like for them, and then anatomically we can bring it up to that position and stabilize it like that. We've got people who are 12, 13 years out and the brows stayed just where we put them through endoscopic surgery.
That's fabulous. Now, when you're looking at the brow and doing the endoscopy, does that shorten the recovery time?
Well, I think it does. I use endoscopes for nearly 100% of brow surgeries, even if I'm taking off skin so I can lower the hairline or something like that, because it allows us to be able to avoid nerves, and so the person has a faster recovery period. And a lot of people only need little tiny incisions for the placement of the endoscope, so they don't have to have a lot of the downtime that people used to have. And some people can be out and about in a week.
Excellent information. Patrick, it's been a true pleasure having you on the show. Really appreciate you coming down. We had a great bottle of wine last night, and we learned a lot today.
That's great. It was terrific being here. Thank you very much for inviting me.
I hope you'll come again.
I definitely will.
Okay. And I know that you have an incredible amount of pictures and information. I'm hoping that you'll maybe do a few educational videos for the Plastic Surgery channel so our viewers can learn even more.
I would be delighted. That'd be terrific.
Well, we'll look forward to it.
Thank you.
So thanks for joining us today. We hope that you'll come back and see the next episodes of Plastic Surgery Talk. Also, make sure to give us your tweets on Twitter and send us email to the Plastic Surgery channel. Until next time, we'll see you there.